Well, I appreciate being here today, and what I'd like to do is talk for the next 40 minutes or so about what I've been doing for 25 years. I'm going to have fun. Hope you have fun as well. So the title is Health Management as a Serious Business Strategy. That's what we've been studying for all these years. So I want you to feel the same level of passion and sense of urgency that I feel. There's no time left in this country. There's no time left in Wisconsin. There's no time left in Michigan. There's no time left in the United States. There's no time left in the world. We have to get these costs under control. And I'm talking about medical costs now, but also talking about productivity costs and expense, but we'll talk about those later. You need to get to the total value of health. You need to get these costs under control. I don't know of any company that we work with, any school district that I know of, can afford to let healthcare costs go the way they're going. The companies that I work with, companies tell me they cannot afford to sustain a business in this country the way healthcare is going. And they have a few more alternatives than you do. They have alternatives that they can ship jobs overseas. We have a lot of examples of that. They have alternatives that do benefit, don't do benefits. They can't do that necessarily for competitive reasons. They have an opportunity to shift all the costs to the employees, more so than maybe you do as school districts. Or they have a way to think about another way to do business. And that's what I think we're about talking here today. That's what we're about. Health management as an alternative to only paying for health care costs. The cost of health care is just unsustainable. The companies I talk to say, how much product do I have to sell to pay for the cost of health care? Now, some of you, if you have a fixed income level, if you're capped, what are you going to do? When healthcare costs go up, what are you going to stop doing? There's no alternative. You have to feel that same passion. I said I'd go any place, anytime over the next 3 years, and I'm into my third year, to talk about this because I want people to understand the importance of this. And there is an alternative, and that's what we're talking about. What we have to do is, where we've been is change from the cost of healthcare, where we focus on the cost of healthcare. That's all we do, is focus on cost. We treat disease. Now I think we're at the place where we understand more the total value of healthcare. What does healthcare, what does health mean to your organization? What does it mean to your districts to have people show up? What does it mean to your district if people don't show up? What's the total value of health? And to get that, we have to start managing health status. However, that's the intermediate step. That's only where we are now. Where are you going in the next year? Can you get ahead of this curve? And to get ahead of it, you have to go, I think, to where we show health is free. You have to get to the point where in your district, or in the state of Wisconsin, or wherever, that health is free. And how do we do that? We do it because we adopt some new paradigms. And I say the example, two examples: quality movement and the safety movement. Both movements, I think, have proven that the money we put into quality, the money we put into safety is free, because the benefits pay for the money we invest. Let me use quality as the main example. It wasn't too long ago that in this country, we had pretty much a domestic market. In this country, would say, we're going to build product, time to outdoor is the mission. How do we get product out the door? We rushed, got product out the door. We came up with a lot of defects. The strategy then was fix the defects, recalls, or just send a new product. Can't do that anymore. It's a global economy. So now we say, all right, what did service, how has service changed? How has quality changed? We said, let's fix the processes that lead up to product. And so we fix the processes and fewer defects. Now I say, in healthcare, how does that apply to healthcare? if you allow me to say diabetes and heart disease are defects, then I would say if we adopt the quality movement, we would say how do we fix the systems that led up to diabetes and heart disease? And that's where health management comes in. That's where you fix it. That's where you go upstream and you fix it. And you can show the same thing with safety. Health management is serious business strategy. That's what I'd like to talk about. I'll give you some introduction to it. Now I'll go into the do nothing strategy. What if you do nothing? What if you don't believe all this and you just do nothing? Then I'll talk about the key beliefs. Beliefs that I think you have to have if you're going to adopt health management as your next level solution to healthcare costs. But if you don't adopt a new way to deal with healthcare costs, you will be out of business. You cannot raise taxes fast enough to pay for healthcare. General Motors cannot sell enough cars to pay for healthcare. You have the same problems, public or private. It's all the same. They're all going up about the same. You got to come up with another solution. And I'll show you the beliefs that you have to do that. Then I'll build a business case, what we've been doing for 25 years, to build the business case of why health management will work. Then I'll go into how do we do it. If you believe the business case, here's how you do it. And I think WEA Trust is one of the leaders in this field in providing resources to a great extent.